Hi everyone, I hope you're all well. My name's Nikki Windsor and I am the Jungle Goddess. I'm a culinary wellness coach specialising in digestive issues and in the connection between gut health, stress and anxiety. So over the past few weeks I've been delving into different digestive systems, so be sure to check out my other videos. Today I'm going to be talking about dyspepsia, heartburn, acid reflux and gastroesophageal reflux disease, otherwise referred to as GERD or GORD depending on where you hail from. Now I hail from the UK, but after 11 years in Costa Rica my vocabulary is an eclectic mix of English, Spanish and American. So I call it GERD and I am ignoring the British silent O in esophagus. So are all of these the same? Well, no, but they are related, and I'll be touching on biology a little to explain this relationship. So dyspepsia is more commonly known as indigestion. It's abdominal discomfort brought on by eating. Most commonly it's felt in the upper abdomen and the chest area. So the symptoms of indigestion can include fullness, bloating, belching and nausea. Now acid reflux is a functional disorder. So the esophagus is a tube that carries food from the mouth down into the stomach. Now at the bottom of the esophagus there's a valve, a sphincter, that should normally be closed. And when you swallow it opens so that the food can pass through into the stomach and then it closes again. So acid reflux is a disorder that occurs when this valve opens when it's not supposed to. Now when this happens, contents from the stomach can flow back up into the esophagus. Now the contents of the stomach are acidic and they contain digestive juices and enzymes that the esophagus really isn't set up to deal with. The stomach is, but the esophagus isn't. Now most people can handle this backwash, for a better word, for a short period of time, but if it happens too much or for too long, then it can cause a symptom called heartburn. So heartburn involves mild to severe pain in the mid-chest area that often feels like a burning sensation. It occurs especially after meals or at night when you lie down. Other symptoms of acid reflux include maybe a cough, sore throat, a bitter taste in the back of the throat, and like a sour taste in the mouth. So heartburn is a symptom of acid reflux, but it can also be a symptom of indigestion. And GERD, gastroesophagus reflux disease, is a chronic and more severe form of acid reflux. Now, what are the causes? Well, dyspepsia, indigestion, heartburn and acid reflux are often related to something that you've eaten, and it tends to be worse after a rich meal, citrus fruits, hot drinks like coffee and also alcohol. Also habits like lying down after eating or stooping, drinking to excess or smoking can also make the condition worse. Heartburn is a common symptom in the later stages of pregnancy. Now, a hiatus hernia, a hernia that really comes up into the upper chest area, tends to make acid reflux more likely. So that covers the what and the why, but what can you do about it? Well, like I've advised in my other videos, if your condition is chronic, you really need to investigate it further to address the root cause. You can check out my video on acute versus chronic conditions here on my YouTube channel. Now, most treatments involve lifestyle changes. So giving up smoking, limiting the intake of alcohol, limiting coffee, avoiding foods that are known to trigger reflux symptoms, evaluating what foods trigger your acid reflux, because your triggers are quite, there are common ones, but then there's ones that are unique to you. Avoid eating late at night, avoid overeating and instead eat little but often. Avoid laying down after eating. Propping your head up to sleep may help if you get that acid reflux in the night. Losing weight if you are overweight can help. Now, chewing gum may help dilute and clear stomach acid that's stuck in that esophagus, but it's not recommended if you have a tendency towards bloating, because chewing gum encourages us to swallow air, and that excess air in our system can cause bloating. So heartburn is quite common and most people treat it with antacids. If, however, you find that you need to take antacids regularly, you really should be investigating the condition further, as you could be suffering from acid reflux or GERD. Now, acid suppressing medications are commonly prescribed, which suppress the amount of stomach acid. But acid reflux can also be caused by insufficient stomach acid as well. So some of the culinary medicine approaches to help reflux include baking soda mixed with water, because this neutralizes excess stomach acid. Ginger is great for many different types of digestive problems like nausea and for bloating, and it's good for these reflux and indigestion based symptoms. Try out licorice root. Now, licorice root can be taken as a tea, as a tincture, as a powder, or as a supplement. It's anti-inflammatory and it's antimicrobial, and it's been shown in several studies that it relieves reflux. Deglycerinated licorice, you'll tell that because it will have DGL on the bottle or the packet, is the best to take in supplement form. You can sip apple cider vinegar, best diluted with some water, and this can help balance your stomach acid if your levels are too low, because it introduces more acid into your system. So I hope that this video has been helpful, helping you understand a little bit more about indigestion, heartburn, acid reflux, and GERD or GORD, and giving you an idea of what you can do to help the symptoms. Now, if you do need help identifying the root cause of acid reflux or any other digestive symptoms, then please do get in touch. I can help guide you to restore healthy digestive function by optimizing your diet, nutrition, and lifestyle. So please join me again next week when I'll be covering the symptoms of nausea and vomiting. All right, have a great week. See you then. Bye.